ready to share treatment tips with those who care at the Caregiver Call Center.
Hey Greg, I'm really excited that my son is starting EPIDIOLEX, but I'm also nervous because I don't know what to expect or what I should keep an eye out for. Do you happen to know?
All right, I was just doing some light reading on exactly this, and experts agree. You know, when you start something new, it's perfectly normal to feel a little nervous. Dr. Labiner would know a lot about this. Hey, Dr. Labiner, how are you?
Hey, good, thanks. How are you?
I'm good. I've got a caregiver question for you that I think you can shed some light on.
Sure thing.
So, what should people expect when they're just starting EPIDIOLEX?
In my practice, when my patients start EPIDIOLEX, I put them on a low dose and slowly increase it over time until they reach their target dose. It's what we call titrating.
Titrating, pulling out the fancy words. I love that. Okay, what else can people expect?
As the dose increases, your doctor is going to want to know if your loved one is having fewer seizures or any side effects, and then they can decide if we need to make changes to the dose. We also may order blood tests to check liver function both before and then during treatment. Ultimately, the goal of titrating is finding the balance between seizure reduction and managing side effects.
Okay, but how do you know what your loved one's dose should be?
It's important to remember that EPIDIOLEX is weight-based dosing, so everybody's dose is going to be a little bit different.
Oh boy, weight-based. Sounds like there's math involved.
Don't worry about the math, we'll take care of that for you.
Okay.
Your provider will calculate the appropriate dose for your loved one. Also, there's a titration worksheet that you can download on the EPIDIOLEX website to fill out with your provider to keep track of every dose.
That's this thing for you folks at home. So what else can people expect?
Well, EPIDIOLEX is proven to reduce seizures in people living with LGS, Dravet, and TSC.
Wow.
But it can take time, so you're going to have to be patient.
Well, I can be patient, but how long does the caregiver and their loved one need to be patient for?
Everybody's response to EPIDIOLEX will be a little bit different. So in my experience, it can take anywhere from a couple of weeks to a few months. So be patient during that titration period as you work to get to the right dose for your loved one. And don't forget to talk to your provider about when your loved one can see results.
Well, that's really good to know. Oh, but what, if any, kind of side effects should people look out for?
I always make sure my patients are aware of potential side effects like increase in liver enzymes, sleepiness, decreased appetite, and diarrhea. It's important to note that these aren't the only side effects people could experience, and some can be managed with dose adjustment. So talk to your doctor for more information and always let them know how you're feeling.
All right, well, thank you so much for walking me through all of that stuff, Dr. Labiner. I know it's going to help a lot of people who are just getting started.
Of course, Greg, that's what I'm here for.
And if you want your own titration worksheet, you can download it at the EPIDIOLEX website. Thanks for watching. I hope this helped.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX, cannabidiol? Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.